Hello, I'm Francesco, a resident doctor at the L'Aquila School of Public Health in Italy. My today presentation is about abdominal aortic aneurysm screening. Incidence and prevalence data of abdominal aortic aneurysm vary considerably in both sexes. 2% and 8% for men and 0.5% and 1.5% for women older than 70 years. Meanwhile, prevalence rate is growing more than 6% every decade, and abdominal aortic aneurysm affects 3 times more males than females. The main aims of this study are to detect asymptomatic cases of abdominal aortic aneurysm and to estimate the yearly prevalence in population sample in the county of Teramo aged between 65 and 79 years. Abdominal aortic aneurysm screening started on December 1st, 2014, and its annual prevalence was estimated. As considered at higher risk, 534 diabetic subjects were recruited as cases within the Diabetes Epidemiological Observatory of our Public Health Service. Meanwhile, a sample of population with the same number of people was recruited as the healthy controls group. Both the diabetic group and the healthy controls group were invited to participate in the screening project through an invitation letter delivered via ordinary mail. In this letter, candidates were informed about abdominal aortic aneurysm disease, the opportunity to undergo this examination, and the screening procedure. Collection data was obtained through the administration of a questionnaire specifically prepared, previously validated, to detect socio-demographic information, some risk factors, presence of cardiovascular disease, and previous surgery. The patients then underwent the screening procedure through abdominal ultrasound exam. As regards results, tables show distribution of diabetic and non-diabetic subjects stratified by gender, of invited person on the left and participants in the screening project on the right, respectively. Our results show that 868 subjects, 657 males and 211 females, were invited in the period from December 1st, 2014 to December 4th, 2015. And 522 of them joined the screening call with a global response of 61.3%. A major response rate was detected in the female gender compared to the male gender, 66.8% versus 58%. So they were more likely to answer the screening call. The average abdominal aortic diameter was 19.2 millimeters, but we detected a difference between the two groups. Patients with diabetes had a mean abdominal aortic diameter almost 1 millimeter wider than the controls group. Overall, 15 cases of abdominal aortic aneurysm were identified, and all of them involved males, 8 of them in diabetics and 7 in non-diabetics. Therefore, the annual prevalence of abdominal aortic aneurysm in the recruited sample aged between 65 and 79 years old of residents in Teramo County was about 3.9% for males. In conclusion, although we have partial data, it's clear that with a timely diagnosis of abdominal aortic aneurysm, we could direct patients with asymptomatic abdominal aortic aneurysm to an appropriate follow-up or elective surgery. Expect a reduction in interventions for aneurysm rupture and a consequent decrease in related mortality. Hypothesize a decrease in the number of emergency surgical interventions with a corresponding decrease of the perioperative mortality. Thank you for attention.